Today I am joined by Stacey Mearns, who is the Senior Technical Advisor for Emergency Health at the International Rescue Committee. Stacey, thank you so much for joining.
Thank you for having me. Hello, everyone.
And the reason why we want to have our kind of COVID-19 session in dialogue with somebody from the IRC is that I think while it is quite appropriate that all of us think of this crisis and the pandemic's impact on all of ourselves and our families and our most immediate communities and where we live, and you know, it has been, in the United Kingdom at least, horrific to see the impact both in terms of people's lives but also in terms of the fabric of our society. It's also, I think, appropriate given what we're trying to do at the Conduit, which is to build a more just, a more sustainable and a more prosperous world, to think about communities who are far, far, far more vulnerable than we are in the developed world, sitting as we are in London. Or as many of us are in London. Many of you have tuned in also from elsewhere. But I wanted to start, Stacey, with the conversation. Can you give us an account of what it is like as a refugee, whose life is already extraordinarily difficult and challenging, deprived of many of the life's most basic necessities, to have superimposed upon that the experience of COVID-19 and this terrible pandemic?
Yeah, sure. I think the main way to think about this is that the impact of this pandemic both exacerbates and is exacerbated by the conditions in which many refugees and vulnerable populations live in around the world. And there are a series of factors that make people particularly vulnerable when it comes to COVID. So the first factor is population density. Many refugees and internally displaced people lived in very cramped conditions, including informal camps, informal settlements, or population dense urban spaces. And the ease with which coronavirus spreads makes these living situations potentially disastrous, and makes people much more vulnerable and prone to becoming infected. The second factor is, forcibly displaced populations, refugee populations generally have difficulty accessing basic services, especially healthcare. Access to intensive care is scarce to non-existent, especially in a lot of camp settings around the world. And it's also harder to access services more broadly, through either fear of harassment or deportation in some cases. And what this can do is really drive transmission of the virus underground as people become afraid to come forward for help and support. I think the third factor relates to limitations in being able to access reliable information on coronavirus, and know how to protect yourself, and also have the supplies and support to be able to protect themselves from infection. And the fourth factor is that vulnerable populations, including refugees, outside of COVID, in their normal sort of living situation, live on the brink in terms of their livelihoods, food security, for example. And coronavirus, really risks exacerbating this even further. And these will be populations who are, undoubtedly last on the list for any government, social or economic support assistance that we see coming in place for coronavirus. And I think lastly, and also importantly, these populations all too often become invisible in response plans. So it's really important that we, do not lose sight of these populations in our response to coronavirus. And this is essential for not only protecting these very vulnerable populations, but also protecting societies at large. If we want to stop the transmission of COVID, we have to stop the transmission everywhere.
So let's start by just thinking about in what ways delivering assistance and seeking to flatten the curve and stop transmission and save lives is much more difficult, right? Because all of these things must make the, both the infection and transmission rates and the mortality rates when people get it that much higher. I mean, people in refugee camps have pre-existing conditions, they have comorbidities, they're vulnerable already as it is. So how do you go about crafting a strategy for a refugee camp in ways that are fundamentally different from how you would do it in, Southwest London or the middle of Paris or Berlin?
Yeah, it's a good question. So, I mean, I think on a macro level, the response is the same in terms of what's needed to flatten the curve. What's very different is the micro level in terms of how we locally contextualize responses. So, on that macro level, we need to ensure that social distancing can be put in place. Now, this is incredibly difficult in cramped refugee settings. The ability to be able to isolate all cases of COVID is really critical for interrupting transmission. Strategies, for example, that we've taken in London is to, have mild and moderate cases self-isolate at home so that we can ease pressure on health systems so that they can take care of, severe and critical cases. Being able to self-isolate at home is a luxury. And a luxury that doesn't exist in a lot of refugee settings where you have really big households. So we're starting to think through different ways in which we can, ensure community isolation through, setting up community isolation facilities, for example, ensuring that, isolation and treatment centres that are established at health facilities are scaled up with the capacity to be able to treat severe infection and, critical infection. Being able to reinforce and protect people's livelihoods is really important. For any of these strategies, to work anywhere in the world, populations need to be in a position to adhere to them. So in positions to self-quarantine, for example. Again, when you live on the brink and your day-to-day access to food is so day-to-day, it becomes very, very hard to actually implement and adhere to some of those practices. So this involves then looking at ways in which we can, provide cash assistance, reinforce food security, and provide those services as much as possible in refugee settings. So the macro level, in summary, is quite similar, but the micro level of how we locally adapt is really, really challenging. And, there certainly isn't going to be a one size fits all. And I think that the most important aspect of designing the right strategy for refugee, camps and settings is actually working with communities themselves. Making them part of the response, empowering them, resourcing them to also come up with solutions that are going to work for them. And I think that's really critical to hold in our minds, as a global community and as response agencies, as we begin to tackle this around the world.
We had a session last week looking at water and sanitation, and one of the issues that arose there is that a very small percentage of the total global population even has access to indoor sanitation. So if you don't have indoor sanitation, the next thing you do is have communal toilets and communal latrines, if you have toilets and latrines at all. And communal toilets and latrines, in refugee camps are places which are transmission vectors. So just even the simple things about where people get water and where people are able to relieve themselves become so much more complicated in these settings. And so I guess the question then is, for an organization like the IRC, whose work is already difficult and challenging and demanding of support in normal times, have you found that you are able to attract specific support to enable you to play a role in assisting communities develop their own strategies to deal with COVID, or is it just another thing over and above your already burdened agenda?
Yeah, at IRC, we've launched COVID preparedness and response programs in over 40 countries in which we work. Our approach has been to leverage our existing work and our existing programs to be able to support with coronavirus. And in part, there is no choice in any of this. It's critical that we adapt programming to make that programming safe for our staff who deliver services, but also for clients who utilize services. So, at IRC, we're really leaning in to the teams that we have in country, to the existing programmatic footprints we have, and adapting those to be able to respond to COVID. So there's a lot of work going on around the world currently, and it's certainly not without its challenges. I think some of the biggest challenges, that we're facing is, the ability to access, areas where we program due to, the physical restrictions that are being imposed around the world by governments as part of COVID response measures. And, the travel restrictions are pretty severe across countries. And I think that's our, biggest and immediate concern right now. For example, out of the 40 countries in which we work around the world, 33 of them have severe limitations on flights going in and out of the country. Since January, we've seen globally an 80% reduction in global flights. So this affects our ability to be able to move people and move supplies on a global level. Within countries, obviously we're seeing lockdowns happen not too dissimilar to what we're experiencing here in the UK. We have in many places been successful in obtaining special movement permits or essential worker status, which is quite similar to what's happening in the UK. And this enables our programs to continue and our staff to be granted permission to be able to move, to ensure that health facilities can stay open and deliver services. And we're also seeing, within countries, the UN Humanitarian Air Service is still operating and able to move. So whilst right now we've seen that big shift globally on movement, for now, we are able to get around in country to continue to deliver services. I think another big challenge that we're seeing that's affecting our ability to respond is the increasing restrictions that are being imposed on basic goods. We've seen many countries now around the world impose restrictions on the export of personal protective equipment. I think 33 governments put restrictions in place in March alone. And these restrictions are, disrupting supply chains, driving up the cost of transportation, and making it really difficult for us to, on a timely fashion, get supplies to where they need to be. So we're really racing to pre-position as much, food, medicine, PPE, and other critical items as much as possible in, ahead of anticipating, growing restrictions both within countries in which we work and also around the world.
So let me ask you a kind of strategic question, which in every effort for social justice that I've ever been involved in, from the anti-apartheid struggle to climate change, I always like to think of it in two ways. One is, what are the arguments from a first principle basis, from the merits, as to why you should care about this particular issue? And that's really about starting from what your view of human rights is, what your view of a decent society is, what you would do, kind of the golden rule about, treat others how you would like to be treated yourself. And then there's a second set of questions, and you should act on those things. And then there's a second set of questions, which is, how do you frame getting involved in this cause or acting on it in terms of enlightened self-interest, people who would otherwise not be moved by the first set of considerations, but who would be inspired to act if you framed it for them in a way that it was in their own self-interest as opposed to other people's interests. And on refugees, I wonder how COVID complicates or assists in how you come to the assistance of refugees. Because on one level, you could imagine it would say, well, if these people were scary already and they were going to come across the borders and they were dangerous and going to take your jobs and potentially insurgents, now they've got disease and it should fuel xenophobia and racism. On the other hand, you could make your first point, which is if we don't deal with this everywhere, it comes and haunts us because it's still live in vulnerable populations. So I guess my question is, from the enlightened self-interest perspective, are there leverage points that you can use in order to drive what should be done anyway to support refugees?
Yes, absolutely. And, those leverage points are the fact that this is an infectious disease, and infectious diseases do not respect international boundaries. With any outbreak of any infectious disease, we are only as successful as our weakest health system around the world. Whilst we may be very focused in our own countries and our own interest to control transmission where we live, ultimately we're always going to be at risk of resurgence, of further waves of cases, as long as there's transmission happening in other parts of the world. And I think it's also important to reflect back to how this started. This is a global problem, and it's a global problem as a byproduct of how globalized our world is. And being a global problem, it requires a global approach and global response to successfully end it. So, I think, being successful in Europe, in North America, in controlling COVID means nothing if the outbreak, causes, ravages through very vulnerable countries and societies. We'll all still be vulnerable.
But to put my more pessimistic, non-optimistic hat on, isn't there a real risk that what happens at this moment is that certain categories of governments who may be so inclined anyway clamp down even further, are less generous to refugees, don't admit people and give them leave to remain, because they are so easily, in the words of one of our attendees who's asked a question, they're so easily stigmatized already. And it's, there's not a lot of people waving a flag for COVID-infected refugees to come over to a country in order to provide them with humanitarian assistance. So how do we ward that off?
I think, fundamentally, in this situation, we have to remember our humanity first and foremost. And that humanity will serve us as we, respond to this crisis within our countries and also globally as a global community. And I think, it's critical that we don't lose sight of that humanity.
One of our members, Anna Jones, who runs RefuAid, has been posting on LinkedIn their efforts to retrain and assimilate doctors in the United Kingdom who are refugees, and then to get them onto the front lines. And I've always thought showing the enormous skill, decency, tenacity, entrepreneurial instincts, humanity of refugees who are no different to the rest of us is always a useful thing to do. And it sort of strikes me that, to be able to flip a narrative to say, refugees are not always, huddled masses of people who need assistance. They are, and we should provide them with that assistance, but they're also people who, can be at the front line of providing us with critical support at this moment. Have you seen that as well in your work, sort of how you flip the narrative on refugees?
No, absolutely, and it's actually something that we are, looking at as an organisation. The IRC does extensive resettlement programming in America, and we are, looking and working and discussing with local public health authorities at the state level about how we can, utilise the populations we work with to support contact tracing efforts. Ensuring that we can get, critical COVID-related information, within vulnerable communities, looking and leveraging, diverse language skill sets, that the clients we work with possess. So we're very much looking, within the US at how we can leverage and support and spin that narrative as well.
Where are you most concerned? Where were you working? Do you think there's just a real, I should imagine you have to do this very complex moral, economic, and political act of triage on a global basis all the time, trying to pinpoint where the need is greatest and then allocating your resources there and then pivot to the next crisis. But where are you really, really worried right now?
It's a tough question. The short answer is a lot of places. Countries that come to my mind that I'm most concerned about include countries that have, very, very large refugee camps, like Bangladesh, that has, the largest refugee camp in the world. The thought of COVID reaching Cox's Bazar and the camps there would be devastating. I think, similarly, all camp settings around the world are a cause for concern for me. Also looking at countries who, where we have pre-existing humanitarian crisis, and thinking about, the potential double emergency that gets created by COVID. So, countries like South Sudan, Yemen, Syria, Venezuela, for example. And then we have countries too that, Burkina Faso, was one of the fastest growing humanitarian crises of 2019, and has rising COVID cases. So, I think across the world there are numerous, countries that are, very concerning, both from the perspective of the transmission of this virus and the ease with which this virus could move, but then also looking at, non-health related factors and thinking about fragile economies, economies in particular that are very dependent on oil, and what will happen when oil prices fall and what that means for people's livelihoods. So, it's something where I think risk is constantly changing. And as an organization, we're constantly, analyzing from different dimensions and frames, to be able to target our assistance and support where it's needed as things evolve.
So Charlotte asks, do you fear even more closed borders for refugees in the future, or is there hope for more welcoming societies in certain countries? If you crystal balled out and say, when we emerge from this moment, is your work going to be, from a host country point of view, not from a situation point of view, harder or easier?
It's a tough question. Personally, I think it's actually going to be harder. I think situations like this, where we see the global spread of an infectious disease, it's very easy for stigma, for xenophobia, to raise its head. And I think, I do worry that as we come out of COVID, that we face, a potential period of more isolationism within the world. So, I think there's an incredible amount of work and advocacy that we all need to do to ensure that, we keep our humanity as countries, as host countries, and as a global community. But I think we're possibly looking at more difficult work as we come out of this.
Is there a case of a country? I always, when somebody says to me, tell me a couple of countries that have done a really good job in balancing all the very difficult economic, political, and ethical considerations entailed in responding to the pandemic, I always go, well, New Zealand has done well. Then I generally say most countries run by women tend to do well. But is there a country or a case study right now where you think there are things to be emulated, where the host country or the country where the refugee camp is situated is in fact being, all things considered, sensible and should be called out and identified for praise? I mean, we like to draw attention to malfeasance and poor behavior, and we should as advocacy organizations, but anything that's praiseworthy?
Not yet. And I say not yet only because the outbreak is still very much in its early phases in a lot of these countries that we're concerned about. Africa, for example, is a good 8 to 10 weeks behind where we are in Europe. And it's also very, very difficult because of a lack of testing capacity to get a real handle on the true burden of disease in a lot of places. So I do have hope that we're going to see some great case studies of countries, particularly countries who have experience responding to other big disease outbreaks and how they leverage and transfer that learning into COVID. But I think we're still very much in the foothills of the response in a lot of these countries. So I would say watch this space closely for now.
Charlotte gave a little prompt about Germany, saying that's probably a place which has been good on refugees in general, all things considered, in recent years. Would that probably be fair?
Yeah, I think Germany, when we look across Europe, is a good case study and example to look at. And I think it's difficult in Europe right now. I think the next couple of weeks are going to be really interesting for learning as we see countries start to come out of lockdown in slightly different ways. The good, the bad, and I think we're going to learn a lot more for the whole global community about how we manage the next phase of coronavirus as we go forward.
Well, Stacey, we have unfortunately come to the end of our session, but I do wanted to say, as an enormous admirer of the work of the IRC, it must be exceptionally and particularly difficult at this moment for the organization, and even more so for the communities who you're seeking to serve. So on behalf of all of us, thank you for that work. Our societies are always measured by how they treat the most vulnerable amongst us, I think. And I think this is a moment where we want to look back in the rearview mirror and say that we're not held to be wanting against that standard. So many thanks. We look forward to hearing from you in the days and years ahead, and to supporting your work from the Conduit's perspective going forward.
Many thanks for having me, Paul. Stay safe.
Bye-bye, everybody. Stay safe and stay well.
Bye.